Hi, everybody. I'd like to welcome you to a little conference that we're having with Dr. Richard Snepar, who's an infectious disease doctor in Central New Jersey. He has over 40 years experience as an infectious disease specialist. And he has been working on the front line of the COVID crisis at a Central New Jersey hospital. And we are so grateful to have you with us today. We are the South Brunswick school nurses, and we each come to you with a question that we think might be important to our staff, and we could share out with them and use your experience. So thank you so much for, number one, your service on the front lines, and number two, for being here with us today.
Thanks for inviting me.
Okay. So we have a list of questions that the school nurses here in South Brunswick have come up with, and we'd like to ask you, if you don't mind. We'll just do a question and answer and no follow-up questions, and then we'll just go to the next person. So I think what we're going to do is we will start with your lovely wife, Mrs. Barbara Snepar, who is the Crossroads North school nurse at the middle school. So Barbara, go right ahead.
One question that I would like to ask is, moving forward, as we do go back to school, do you think it's going to be important for all nurses and all people really in general to have their own pulse oximeter? Is that important? And in addition, could you talk about, when we do go back, the PPE that school nurses might need to function as in our role as the health professional in the building?
Okay, so those are two separate issues, but both of extreme importance, and we can probably spend the whole portion of this program on that second part. But just addressing the pulse oximeter, as you know, we're all seeing patients. I mean, when we see patients, we take vital signs, and the vital signs characteristically were, fever, temperature, respiratory rate, blood pressure, and now, the inclusion of the pulse ox is really critical as one of the most important vital signs in this kind of epidemic. And I think monitoring the pulse ox, or the oxygen saturation of a patient that is suspected of having COVID is critical. It gives you a baseline. It gives you a way of following their oxygenation, and that's really a major sign that we follow in the hospital. It's where the oxygen is, where your oxygen level is going, where it's been, and how you're progressing. So, will that be a utilizable parameter in the child, or the student? Remains to be seen. But it will. I think it can only add to your evaluation. You should. Students should have an excellent pulse ox. They should probably be 99 to 100. And if you see somebody coming in with a lower pulse ox, it's going to raise issues, as it would among a staff member as well. And then the second part of that question regarding PPEs, well, you're nurses. I mean, you're healthcare workers, just like I am. You are going to want to protect yourself. You want to protect yourself from the unknown infected patient. I mean, what happened early on in the HIV epidemic, when prior to that, nobody even wore gloves in the hospital, as some of you may recall. So and then there was the big concern. Well, how are we going to protect ourselves? Because a lot of people had HIV, and you didn't know who had it. So now HIV was transmitted via blood. In terms of one of the mechanisms, and that was the concern in the hospital. So everybody then adopted universal precautions, because you didn't know who had it. So, and the thing to do was to wear gloves to protect yourself from getting blood inoculation or blood contamination. So you bring that to now. Again, we're in a situation where asymptomatic transmission does occur. You may see patients that don't know they have it, and you need to protect yourself. And I think it's going to be necessary that you all have personal protective equipment to protect yourself from the asymptomatic student and staff member.
Excellent. Okay, great. All right, thank you. And then next we have Jennifer Duvelsdorf from Crossroads South Middle School, school nurse.
Have you seen a connection between Kawasaki disease and COVID-19 in children?
Okay, so, I'm not a pediatrician, so I don't see children. But, I've seen Kawasaki's disease, and I know what Kawasaki's disease looks like, and it doesn't really look anything like COVID. Kawasaki's disease is a disease of prolonged fevers, manifested with enlarged lymph glands, lymphadenopathy, and associated, cardiac issues. It's not, as best as I know or seen, a respiratory disease, and COVID is primarily a respiratory disease.
We have Janice Royer, who is also a nurse at Crossroads South Middle School.
I have a question. If someone is sick with COVID at home, what recommendations do you have for self-care to help prevent the worsening of the illness and the need for hospitalization?
Well, okay, so if somebody's at home, you're going to need to practice. It's a multifactorial issue. First of all, you want to practice prevention, and also you want to try and nurse this patient back to health as well. So you need to protect yourself. You need to practice prevention. You'd be, keeping as much social distance as you can, and that's, greater than 6 feet or more. You want to minimize your interactions with that person as much as possible. You want to keep him, he or she, isolated in a separate room. You want to keep the associated areas disinfected and cleaned. And then now also you'd want to, again, limit your contact, but on the other hand, you need to take care of the person. So, you want to make sure that they have their medications administered, follow their doctor's orders, and like we're doing in the hospital, you try and you don't do things like you did normally. Medications that are given twice a day, if they could be given once a day, they're given once a day, so you don't have to go into the room twice a day. You'd want to get everything done at once and then get out. Also, if you're going to be taking care of whoever's taking care of that person, you want the caregiver to be as healthy as possible if you have the choice in the house. You don't want, if you have a choice of a caregiver that has underlying immune problems and hypertension and diabetes, and you have a caregiver that doesn't have those kind of things and is reliable, you'd want to let that caregiver be administering the care. Mm-hmm. You want to avoid visitors. You'd like to maintain good airflow in the rooms, so to reduce infectious particles. The caregiver, you'd like to wear a mask. What's available to the caregiver now is cloth masks, which are not that protective to the caregiver. I can't recommend a surgical mask because they're really being, the party line is to reserve all those surgical masks for the healthcare workers. Mm-hmm. And now now we're in the home situation. So, the recommendation is to use a cloth mask, but, it's not as optimal. And then, you want to, as I mentioned, clean. I'm not sure if I mentioned it, but you want to keep the area clean. You can wash the clothes, with other clothes, but you can mix them. That's not that big of a deal. And you want to eat in separate areas, of course, things like that.
Next, we have Jill Kerwin, who is a South Brunswick Cambridge school nurse, and she has a question for you. Bill?
Thanks. I have a two-part question that they're somewhat unrelated. One is, what do you think schools are going to look like when we go back? We've been hearing lots of information about masks and separation, and just not sure if that's something that we can really do in the US. And then my second question is just, as in my neighborhood and, people in school, we're constantly talking about how necessary it is to disinfect things like the mail, our groceries, and packages, and just wanted your thoughts on those.
Right. So I'll take. Yeah, it goes back to. Am I muted? No. It goes back to basically the transmission of this virus, and I think everything ultimately stems from that. The virus is contracted via the nose and via the mouth and via the eyes. And that's been pretty standard. So you want to prevent transmission of this virus to your mouth, your nose, and your eyes. Okay. And the best way to do that is to protect your mouth, nose, and eyes, and also wash your hands frequently. Because if you don't have virus on your hands, then you're not going to transmit it. Also, you then want to also be away from people that are putting this out into droplets, which the word, the feeling is that from studies that a droplet the virus in droplets will carry about 6 feet. It's not hard and fixed that it's going to end at 6 feet. A little bit of a more vigorous talk or sneeze may put it beyond 6 feet. Less than, a vigorous expression may bring it, shorter than 6 feet. But that's sort of the average, and that's where the social distancing thing came from. So anyway, so when you're in the grocery store, you have to be concerned that so you don't want to contaminate your hands with virus. You don't want to contaminate your face with virus. And the issue is, how long does the virus last on some of the stuff you might be getting? Now, once the virus leaves somebody's mouth and lands on something, it's going to start to die. Okay, and it's going to become less and less transmissible over time. It's going to start so after 24 hours, it's probably going to be very unlikely to be transmitted. And after 72 hours, it's going to be really unlikely to be transmitted. So if you have like a jar of tomato sauce or something like that, and you can put it in a cabinet and you're not going to be eating it for a week, it's not that big a deal. You can just put it away. If you have something you're going to be sort of taking sooner, well, then it's a good idea to clean off the surface if that surface can be cleaned off. And you want to clean it off with really soap and water, because you don't want to get sick from a disinfectant. And that's foodstuffs. It's probably a good idea to wash vegetables and fruits and things like that with, where you rinse it off with cold water. If you can wash things off with, that you're going to be using frequently with soap and water, that would probably be a good idea. So you want to reduce that. Now, mail, and I think it's a good idea, it can sit on cardboard. It's a good idea to disinfect the package for a good like 24 hours and then open it up, cardboard package. Mail is tough. It's hard to sort of take a letter and spray it down or, disinfect it. But so you read your mail, put it away, and then wash your hands really well. I think this is the thing to do. And that's what's recommended, actually.
Okay, thanks, Rick. Okay, next we have Barbara Demetrician, school nurse at Greenbrook Elementary.
Hi, I have a question. I've heard that some people have tested positive for having COVID-19, and then when they went back for follow-up antibody testing, that was negative. How does that happen?
Okay, that's a good question. So you're positive for COVID, and then you expect that you're going to get an antibody. Now, okay, so one thing is you got to give time for the antibody to to generate an antibody. And there probably has been time to generate an antibody because it's taken so long to get these antibody tests out. But so it usually takes about 14 days from the onset of the illness to generate an antibody that you're going to pick up. The problem is that the state of antibody testing right now is is in its infancy. There's a lot of antibody tests out there. Some are not as accurate as you would like. There's a lot of different pieces of the virus that generate antibodies, and it depends on what piece of the virus you're going to be testing against. So there may be some inaccuracy in the antibody test, and also it's also been said that with mild disease, you may not generate as high an antibody level. Now that may not mean that you're not protected. It just may be that you don't have a measurable antibody. It's all about cutoffs and how low you're going to, grind your tests down to try and pick up an antibody, or how that test is going to represent that antibody. So it remains to be seen. It's not an exact science at this point. What antibody testing should be done is still unclear.
Next, we have school nurse Suzanne Hansen from Brunswick Acres for the question.
Hi, Dr. Snepar. Thank you. My question is, what is the current situation with PPE in your hospital? Is it better now, or do all staff still have to reuse during multiple shifts?
That's a good question, because I'm living it basically. So it was really interesting when we first, this epidemic first started. And I've been down at Central State Hospital a lot. We go to Robert Wood, St. Peter, but I've been assigned down to Central State. And you would go to the room, and right next to the room there was a cabinet. And in the cabinet, on the first level, it had like all the gloves and everything. And then on the second level, it had all these, like, tons of gowns. And then on the third level, it had the N95 masks, as many as you want, N95s. And then there was a big sign on how to put your gowns and gloves and mask on, and how to, in the right order, and then how to take off your gowns and gloves and mask in the right order, in the room and everything like that. That rapidly disappeared. Okay, the PPEs are sparse. Okay, and they're up and down. Like, some days you'll get there and there'll be no gowns. So you really need to wait for delivery of gowns. Yesterday there were a lot of gowns. There were gowns all over the place, so it was really good. But originally you were supposed to wear a gown into each room, take it off, throw it out. We're not doing that anymore. You're trying to go from COVID patient to COVID patient to COVID patient in the same gown, because there's not enough gowns for everybody to take off and put on, so and throw away, because you have nurses going in, you have physical therapists, you have oxygen respiratory therapists, you have the people that are delivering food. I mean, it's a big number of equipment, as a matter of fact. So, and now what we're doing is, instead of using an N95 mask with each patient, okay, so now you keep the N95 mask on, and at the end of the day, you have the mask. The mask is actually cleaned. It's radiated with ultraviolets, and then you get the mask back, that's not bad. I mean, there's been data to show that the mask can be utilized over and over again, if cleaned properly. So, there's been some learning in this whole thing. Just some hospitals are electing to not isolate for MRSA and multi-drug resistant gram-negative rods, because we don't have gowns to do everything. So there's a big problem with PPEs. Now, admittedly, years ago, nobody isolated for MRSA either, and people got by. But it's of concern. It's a big issue.
Okay, thanks. And next I have a question, Dr. Snepar, and that is, when do you think that we will be out of the height of the pandemic in New Jersey? Do you see an end in sight, a drop in cases?
I was hoping that, getting into the summer, we would start to get out of this pandemic. As we all see, we follow these curves on the world meter or just from the hospitals. It would look like things were starting to slow down, especially in New York and New Jersey. Locally, hospitals have started to cut down their COVID wards. A lot of floors have started to open up for regular patients. That's happened at all the hospitals I've been working at. Robert Wood's numbers are down. St. Peter's numbers are down. Central States are down. Although I'm concerned over the last, if you look at the curves we started to drop into a decline, but that decline looks like it's plateauing right now. And we just have to continue to see what's going to happen. There's been some relaxation, as you all know, of precautions. There's a lot of fatigue in this whole quarantine thing. Are people going to be able to keep it up? Right now, it looks like there's a little bit of a plateau. We've got a bunch of COVID consults this morning. Had a bunch yesterday. We'll have to see.
Thank you. Who's that? Christina?
Yeah.
Okay, so next we have Christina DeLucia. She is a district-wide school nurse. Go ahead with your question.
Hi there. Thanks for coming. So my question is kind of piggybacked on that one. I know that we're seeing sort of a plateau, and who knows where we go from there as we relax things. But my question is for a little bit further out. Do you have a lot of concern going into the fall months of a resurgence of, this coming back up, and, how do we handle that?
Right. I'm concerned about the resurgence in the fall. I'm concerned about persistence over the summer. So it's going to need to be handled. Hopefully there'll be ways to mitigate the infection more, more efficiently than we're doing now. As we all know, information is coming at a very rapid rate with this disease. So, we know a lot more this month than we did last month. And I'm hoping by the end of the summer, we're going to have a lot more information. Maybe vaccines will be available. They'll be on the horizon. Maybe there'll be more. We'll realize that some of the therapeutics are much more efficient than we think, and they can be more readily available, which will take a lot of the fear and concern away. A lot of the concern of the flu is mitigated by the fact that one can take Tamiflu and start feeling better, pretty quickly. If there was a therapeutic regimen for coronavirus, it would be extremely useful. And how further it's going to look in the fall, I can't. It's hard for me. It's hard for me to predict. I think we're just going to have to see. But it's going to have to be in. I think one's going to have to get into anticipating how to proceed if things look like they do now.
Okay, next we have Rena Eng, who is a South Brunswick High School nurse.
Hi, Dr. Snepar. My question is, how contagious is an asymptomatic COVID-19 infected person, and what's the chance that person can infect the medical and/or dental community who are already following universal precautions? Thank you.
Okay, so asymptomatic transmission is definitely an entity. Okay, and it's been looked at. It's been said that, and this is from studies from us study in China, that the greatest period of infectivity is within the 2 or 3 days prior to when getting symptoms. And then it really peaks about the day before you get symptoms. And then it starts to fall. There was a study in nursing homes showing that 6 days prior to symptoms, there was evidence of infectivity. So asymptomatic infection does occur. How much of a factor that is in the entire scope of illness is hard to say. I think they measured it in Singapore. They found that about 6% of their transmission was from asymptomatic transmission. Now, however, it's been shown, it's part of the second part of that wearing protective equipment will prevent infection. And even as much as a surgical mask and good hand washing will prevent the caregivers from getting infection. There's studies out of China that showed that when even with aerosolizing the virus, in a hospital, unknown workers, healthcare workers that were exposed to these large loads of virus, whether they were wearing a surgical mask or an N95 mask, 0 patients came down with the illness. So it's all going to come down to protecting one. It's not all going to come, but it's a lot. It's going to be necessary for the healthcare worker to protect oneself against the asymptomatic patient with the precautions that have been recommended.
Okay, great. Next we have elementary school nurse Susan Neese at Brooks Crossing.
Thank you, Dr. Snepar. Do you see a need to enhance the immune system, especially in older patients, like taking supplements, or I just recently heard about Tagamet might help boost up the immunity, your immune system to fight this better?
Okay, so it'd be great if we could enhance the immune system. I'm just not quite sure how to do it. A lot of the recommendations to enhance one's immune system, are homeopathic type remedies, and it's hard to know, how well or not they work because they haven't been, subjected to some rigorous studies. I also saw the talk about Tagamet and H2 blockers against the virus. It's interesting. It's just sort of been talked about a little bit. I don't know if it's recommendable yet, although it's a pretty harmless intervention, and it may be important in actually not enhancing the immune system but interrupting the virus. It's just hard to enhance the immune system, and it's interesting in the elderly because some elderly patients handle the virus very well, and they have and I'm talking about very debilitated elderly, and they'll be fine, and then some will get have a lot of trouble battling it. And in some cases, immunity is a problem with this disease because it's the hyperimmune response that really gets a lot of people into trouble. And you've all heard about cytokine storm and things like that, which is a big problem.
Right. Okay, so next we have a district-wide school nurse, Lynn Ostroff.
Hey, Dr. Snepar.
Hi.
Thank you for being here today. I have 2 questions, actually. The first being, what are your thoughts about wearing masks outside during exercise? People cannot maintain proper social distancing at all times. And do you suggest that people wear masks wherever they are when they're outside, regardless of whether they're just going into a store shopping? The second question is about hospitals starting elective surgeries again. Do you have any sense of that?
Okay, so regarding social distancing and exercising, so the mask one would be using when you're out doing social distancing is to help is actually a public service, right? It's to keep you from spreading your virus to the next person who's out there. And so that's an important piece of people keeping other people from getting into trouble. Now, while you're out and like you're exercising, if you're not in the vicinity of somebody, I think you don't need to wear a mask. You're not going to be contaminating somebody. If you're in your car, for example, you don't need to be wearing a mask. But if you're going to be among people, within that, these social distance, paradigms, then it's a good idea to mask. I think it'd be hard to jog in mask personally, but or exercise in mask. It'd be difficult. But if you're going to be among people and doing it, yeah, then you need to, it's advantageous to mask for others, and you're hoping others are masking for you.
Mm-hmm. Yes.
Oh, and then the second question was, surgeries. I think that's going to happen soon. They're opening up the wards. They're talking about levels of elective surgery. Some are more elective than others. And they're talking about sort of stratifying that and getting people back into the hospital. The whole thing was they had to really reserve ICU beds for potential people with this virus, and because they were going to be utilized. Now, those ICU beds are starting to open up. And so now you can anticipate having an ICU bed if somebody gets into trouble in the OR.
Okay, thank you. And we have school nurse Eve Smogard from Constable with a question.
Good morning. In the Journal of Hepatology, and it stated that COVID-19 had multiple routes of infection, including an oral fecal route. Do you think this virus might also have a transmission that's similar to a norovirus, and that might help with why it's spreading so fast?
The virus definitely is in the gastrointestinal tract. It has been found in stool. It's been found in secretions. It's hard to know how important the fecal oral transmission has been. There's just very little data out on how that's translated into transmission. Now, again, this virus has been shown to, it's carried by droplets. It attacks the respiratory tract, so it has to really aerosolize to get in. It attaches to the nasal mucosa, the oral mucosa, and then into the lung mucosa. So it really has to, aerosolize out of that into the air. There's not good data that you ingest the virus and then it causes disease. Unlike the norovirus, where you ingest it, you get it on your hands, you take it in, and so it's spread like it's fecal to oral transmission. So this is in the stool, as you pointed out, and I guess we just need to see how that's going to play out, if there's going to be further information on that kind of spread.
Next, we have Bin Guo, who is the South Brunswick High School nurse, and she would like to ask you a question.
Okay. Hi, Dr. Snepar. Thank you so much for being here. My question is, do you think the large-scale tracking of positive, COVID-19 patients with their antibodies will fasten the vaccination process, or to fasten the convalescent plasma treatment process?
Well, I think by picking up survivors of COVID and picking up their antibodies will be a great source of mining plasma for convalescent therapy. So if one could track that, once large scale antibody testing is done, I think it'd be really utilizable in terms of being able to use them as these individuals as potential donors for for plasma, and plasma is being utilized in the hospitals, convalescent plasma. Whether how it's going to impact on vaccination, would remain to be seen. I mean, if there's not enough information out on the protection in terms of the antibodies, but if one is protected via their antibody, then just like as one had natural measles, for example, they would need a measles vaccine. They had, already natural mumps. They would need a mumps vaccine. Is this going to be akin to that, or everybody's going to need to be vaccinated anyway? So, but it may be that if patients are tracked and they all have their antibodies, and those antibodies are deemed to be protected, they may be people that are spared vaccination and just confer, their own immunity.
Great. One final question, unless somebody else has a question. I just wanted to ask, this coming Friday, we have what we call Fun Friday with our children. And they will be expected to go outside, enjoy the outdoors if it's a beautiful day. We do have many parents in our district, according to my teachers, that will not let their children outside even to play in their own yards because they're fearful that the COVID is in the air. Can you speak to that, to allay the fears of parents about a child playing in their own backyard, social distancing with family members?
I think that's the one thing that can be done at this point. I mean, everything else is restricted, but I think going outside and being able to play and, with responsible social distancing is fine.
Mm-hmm.
I think if you think about how these things are transmitted, it's going to be dispersed in the air. I think, we're not talking about transmission in that manner.
Right. And even bike riding, because I think you have to have at least 6 feet social distance when you're bike riding with another person, right?
Sure. Yeah. I think, bike riding is great. As a matter of fact, I was out doing it this weekend.
That's awesome. All right. Well, I think, does anyone else have any questions before we let Dr. Snepar go back to his busy life? No? Okay. Well, we want to thank you. Wait, what?
Donna.
Yes.
I have one question. I'm feeling I feel like it's unclear our return to school and how we're going to return safely, and what recommendations that you would have. Like, even we were talking about having them come and empty their lockers. What are your recommendations for the students to come in, empty their lockers, and take their belongings home for this year?
Recommendations on how to proceed in the coming year safely is probably a brainstorming, multi-hour discussion and decision making. It's a major issue. It's probably going to take you all summer to figure out. And I would start working on it, because it's going to have to incorporate all these factors we've been talking about. And, who's going to be at risk, who needs to be protected, how are you going to protect them, what are the risks, are you going to be able to keep people, how are you going to interface teachers with students, the asymptomatic from the symptomatic? It's a big deal. And, it's going to require a lot of discussion.
Okay, one final question from me, and I'm sure everybody has this question, is, do you have any idea why a seemingly healthy 20-year-old can be so impacted by COVID to the point that they're on a ventilator, while a 91-year-old with a failing health comes out of it? Is there any thoughts with the doctors as to why that is, or if there's is there a deeper level of the virus, or?
It's very multifactorial. And remember, this thing's really in its infancy. I mean, this thing's only been out for a few, maybe 6 months max, worldwide, and a few, several months in the US. I mean, it's really, in terms of checking out, a viral illness and all the machinations of that, it's very, very early. And that's a major question. why will this patient do so badly and this patient not be touched?
Mhm.
Is it amount of virus they come in contact with? Is it underlying disease? We know the typical underlying diseases: hypertension, obesity, diabetes. But it seems even more. It's more than that. Is there a genetic
Mhm.
factor? Why are Hispanics and African Americans
Mhm.
doing so badly?
Right.
And it's beyond. It's beyond crowding and risk of picking it up. So that kind of stuff is trying to be sorted out. I mean, they are doing genetic testing, and immunologic studies. It's a study in progress.
Mhm. Okay. Well, thank you so very much, Dr. Snepar.
Thank you.
We are so grateful, and
Sure,
we really,
pleasure to be here.
maybe we'll have you back in a couple of months, and we can get some more information.
Sure.
All right.
Thank
Thank
you.
you.
Thank you very much.
Thank you so much.
Have a good day.